Good afternoon, all. Dr. Jared here, bringing you another round of integrative medical approaches. Wanted to specifically spend about half an hour here talking about regenerative medicine specifically, and mostly stem cell therapy. I've had quite a few people over the last couple of weeks ask me about when was the next time that we were having True Health come in and have the opportunity to have regenerative medicine assessments for specifically for most people for joint pain. So if this is new for you, what we're talking about is stem cell therapy, which is an undifferentiated cell which is able to help your body heal itself. Anything that we bring to you is designed to have your body's innate capacity to heal itself. So there are certain times where, whether it's arthritis or degenerative conditions or old sports injuries or car accidents or whatever it might be, certain joints get damaged to the point where the body can no longer heal them. And as most people are aware, surgery is just flat out not a guarantee. And so this is a much more conservative, it's a much safer, it's a much more natural alternative to surgery or dangerous steroids. So what we're going to do today is really go through how it works, what it does, some of them frequently asked questions. So you really have, at the end of this half hour, a really strong baseline for understanding what this is, and if it does fit you, the opportunity and how you can be assessed to see if you are a candidate for a procedure like this. So to start out, I mentioned the company. It's called True Health Medical, which has a very large backing. The one thing I'll say about this, without going into it a lot of detail, is most companies don't have the backing where they can control and make sure you're getting a top quality product all the way from where the stem cells are harvested from, which is what's called mesenchymal, or from umbilical cord blood of a healthy mother and healthy child, through the laboratory where it's screened, all the way flown directly to where you'll have the treatment done. So it's one of those things where you know what it is, you know that who it's from, you know what it is. And so there are not very many companies that have been looked at and have had the FDA even be present and assess the laboratory and make sure that everything is at the top level of effectiveness, let's say. So a couple things, like it says on this slide here, ultimately we're trying to allow your innate ability for your body to heal or to function better. So your body produces stem cells and then turns them into whatever it needs. So stem cells can turn into bone, they can turn into muscle, they can turn into cartilage and other types of soft tissues. So why is it that you would need an outside source of stem cells? Well, that comes back to, as you age, your body produces less and becomes less and less effective at healing itself. So when you talk about this regenerative approach, a stem cell is, again, an undifferentiated cell, meaning that it can turn into anything. It's kind of like the jelly before it turns into whatever your body needs it to. This is also why when you hear people say it just seemed like when they were younger they healed faster from injuries, it's because a big part of it is that your body produces more stem cells when you're younger. So who qualifies for stem cells, although there is a vast array of research being done with stem cells, from everything from multiple sclerosis and heart disease treatment, all the way through what we're talking about today, which is joint repair. The most common use of them right now and the most research is for joints. And there are, this is a medical procedure that is being done both in the natural and medical realm. I will tell you, I have had clients that have sought treatment up at, for instance, UW-Madison, at the hospital up there, and also, from many other, locations. There's also research being done right now at the Mayo Clinic where they're injecting stem cells and then they're following up with multiple MRIs to actually track the amount of tissue growth and how much a person needs. So it's really trying to dial in the treatment effectiveness. But what it really comes back down to is the quality of the stem cells themselves, the body's ability to use it to multiply these cells to help you repair. So if you knew nothing about stem cells before, it's an undifferentiating means that it can turn into any type of cell, and it's your body that tells it what type it needs it to turn into. So it's still an innate or an intelligence within you that helps your body heal. The other thing about this is the reason why the dosage and the quality is so important is it's not really what you have put in, but more importantly, the amount of times that they replicate, or how having a fertile ground for your body to turn them into something else. And so why it's so effective in joint repair is over time, for many people with injuries or repetitive use problems, their joints wear out, so that whether it's the meniscus in the knee, or whether you tear one of the ligaments, or in the shoulder, whether you have, for instance, tendonitis in the rotator cuff or the bicep tendon, or you have micro tearing, which is very, very common for people to develop as they age. We are even able to now do them in hips on a good percentage of people. So for people that are trying to avoid hip replacements, things like that. But the things that they do, one of the ways that you get pain relief is they actually go into the joint and they reduce inflammation. They also help your body to stop the degenerative process by growing, or almost telling your body that you have a stronger amount of these healing or reproducing cells. Now, there are a couple different sources. And so, the type that I think is best is called mesenchymal. Now, the type you see on this slide right here, these are called autologous. Now, autologous is the type that's been used for many decades in the medical world, and the easiest spot for you to have heard of them is a bone marrow transplant. So if somebody has cancer and they have chemotherapy and it kills and wipes out so much of your actively dividing cells, what they do before you have some of the really intense chemotherapy, the certain types of it, is that they extract bone marrow or the stem cells from certain bones, and they help them replicate, so that after you're done with the cancer treatment, you put that back into your system and it helps your body repair. It helps you become healthier again. They can also be extrapolated from body fat. So for those people that want to use their own stem cells, they can, but there's a few downsides. First of all, the older you are, again, the less stem cells you have, so you're going to have a lower amount to try and help replicate. It is invasive, so you have to go in for multiple procedures versus a single procedure. So you have to go have them extracted, then grown, and then you go back and have them reinserted into the joint that you need treatment on. So with the fat or the bone, it can be very painful. It's multiple procedures, so it is, if you're personally paying for it out of pocket, it is more expensive. Obviously, there's some rehabilitation time from the extraction sites. And like I said, the older you are, the less effective that it is. So the type that I personally like the best are called mesenchymal. And so again, True Health only uses mesenchymal. But this comes from the umbilical cord blood during a pre-planned C-section of healthy people. So that blood is typically thrown away. So it's wasted. So we're really harnessing the body's already what it was already being given. You're harnessing something that currently is not being used and helping people heal from it. So nobody is giving up anything. Nobody's being injured. Like I said, although I'm a big advocate of natural deliveries when possible, certain people elect through medical reasons or other to have a C-section, and those people then also have been screen tested and they consented to this. Like I said, there's no potential for these to have negative reactions because they're a completely undifferentiated cell. So for instance, it doesn't matter what the patient's blood type is because it doesn't account for blood type because they're still undifferentiated. And because they're the most dense they could possibly be because they're young. They're essentially for the baby, which has the highest amount of stem cells per cell of any type in the body. Now, this is my favorite slide. So if you're watching this on your phone, you might want to zoom in on this slide. But ultimately, this is why people need stem cell treatment as they get older. A newborn baby has 1 stem cell per 10,000 cells. And keep in mind, you have trillions of cells in your body. So that's a whole lot. By the time they're a teenager, they have 90% less. It's back to 1 in 100,000. By the time they're 35 years old, it's gone considerably less than that to 1 in 250,000. If you're 50, it's 1 in 400,000, or just 4% percentage-wise per billion cells compared to a newborn baby. And an 80-year-old has 5 times less than that per cell, so 1 in 2 million. So for many people, as they're aging, let's say your knees hurt and you can't run anymore, or you're limping, or you're trying to avoid a knee replacement. I hear, this week alone, I had 3 different people that I showed x-rays to that were under 50 that their doctor told them they need a knee replacement, but they're too young. And so this is an excellent alternative if you're trying to avoid that, because again, it's while it does help, those surgeries can help many people, they're not a guarantee, and they certainly don't help everybody. And quite frankly, even if you did this and still had to have a knee replacement, you're no worse off. That's the beautiful thing in it, and is that the side effects or the risk is so incredibly low. Really for the most part, it's just the same risk you'd have if you gave blood, or if anytime you have a needle injected, because you expose your body to some level of risk of infection. But again, it's very, very low. So here's the process. So as you can probably see on there, but just for those that can't, it's from the C-section, again, collected, sent to a lab where it's tested. They do a series of lab processes, test it again. They get it down to specifically to the stem cells, and then they freeze it. So these stem cells have a life expectancy of roughly 6 months. So they need to be used fairly soon from the treatment. But again, I just want to talk about the not only effectiveness, but how much potential there is. For those of you that have heard me talk about this before, my oldest son, when he was born, we actually did this, but not for somebody's joints. We did this for the potential medical research that's coming out. We had my wife's cord blood saved, and we paid for it to be saved for a period of time, so that as research happened, in that rare case that my children would have any genetic diseases, if they were able to develop treatments for those, we would have their matching stem cells for it. And so we paid a multiple $1,000 fee just for that, because that's the potentially the future of a lot of medical treatments. But like I said, right now, what's really been proven to work is to use stem cells for joints. Now, again, I get asked fairly frequently, like, are they safe? And so ultimately, this is another reason why I like this lab or this company so much, is not only do they test for all the required testing, they test for all sorts of other conditions, diseases, viruses, to make sure that what's being transferred to you is completely safe. Additionally, what's in it? So how do you help them grow? I mentioned that these things multiply. They grow or multiply for 3 to 6 months. So this is how your body helps and replicates the healing. So not only do you have mesenchymal stem cells injected, but they also have things that help your body multiply and repair. So the easiest analogy I was given one time is to have think of scaffolding. If you had to build a wall, after it got taller than the person was able to build it, they would have to build scaffolding. And so these cytokines, which are cell signalers for repair, growth factors such as hyaluronic acid, which is something, again, the joints naturally produce, but may not be producing as effectively as they've been aged or worn out. So some of that's injected in, and other proteins and electrolytes, which, like I said, help the mesenchymal stem cells grow. So help build that matrix to build as much as you possibly can and make it the most effective that it possibly can be. I already mentioned these treatments, but again, it's anti-inflammatory, it's pain reducing, and ideally it helps people avoid surgery. The areas that it can be done in, it can be done in people's shoulders, knees, elbows, hands and fingers, feet and ankles, as well as hips. So if you have pain that you've already tried to treat with chiropractic or physical therapy, this is the next logical step. So I would do this before I'd have steroids. I mentioned just how serious steroid injections are. Steroids themselves, when you inject a steroid into a joint, for most people, it does reduce the pain. Unfortunately, it does the exact opposite of what a stem cell would do. Steroids are actually shown to make your joints more brittle and make you need surgery more quickly. If you've had multiple steroid injections, not only are you more likely to need surgery, but you're actually less likely for the surgery to be effective due to the damage that occurs to the other joints. Many of you may remember, even it was like publicized on lots of news articles, and there were even a couple movies that showed this in the 1990s. But in the 1980s and 90s, especially with athletes, we'll use football as an example. An athlete might have severe knee pain to the point that they can't run, and instead of being taken out of the game, they were injected with their knee so full of steroids that they couldn't feel the pain, so they could get back out and play the game. But what it would do is destroy their joints. It ended so many careers early. It would be like if you took so much ibuprofen that even though you had a severely sprained ankle, you could go out and run a marathon. At the end of that marathon, you know what that would have happened to the ankle, but yet unless it was a life or death situation, it just doesn't make sense to put that kind of stuff in there. And yet, because it's covered by insurance, some people turn around and they'll take that, or they'll just, a doctor will inject it and not give people the risks versus the benefits discussion. On top of that, like I said, with these surgeries, there are people who have, surgeries that are very effective, but once you've had the surgery, if it doesn't work, there's really no going back. I mentioned this earlier, but there are so many things that there's over 5,000 studies being done on stem cell therapy at the time of this seminar recording. And so there's just realize that because your body's healing itself, there's to some degree an unlimited potential. Not that different than when we talk about with chiropractic. When you get adjusted, you really don't know all the benefits. Yes, many people get adjusted when they hurt, but ultimately, because it's a neurologic response and your body's healing itself, you may or may not feel the net benefits that are occurring. Similarly, when you have this done, yes, pain relief is a big goal, but ultimately what you're trying to do is get your body to heal itself. So the last few things that we want to do here are just really talk about some of the questions, or the frequently asked questions. Now, is stem cell therapy safe? I know I addressed that already, but with the amount of pre-screening and things that are being done, it's incredibly safe for the person. There are a few questions that get asked with making sure that you are healthy enough to receive this, but the overwhelming majority of people are healthy enough and have a high likelihood of success. Number of treatments needed. Although there are no limit of treatments that you can do, the majority of people have one treatment over the course of several years. Now, if you have severe degeneration, like you're trying to avoid knee replacements or shoulder replacements, or really joint replacements in general, that person is the most likely to, down the road, need multiple injections, because frankly, there's just less cartilage and there's less space for the person to see success. So who's most qualified? Although there are quite a few people who have done this in an effort to avoid joint replacement and have done very well. People who receive treatment before they're at that crossroads of possibly needing a full joint replacement seem to do even better. So from my experience, what I've seen so far is the more cartilage or the more space that you have, the higher the success rate. So although pain is a good motivator, the earlier you do this, the higher the success rate. And what is the exact success rate? That's a number that's so highly variable, it's very difficult to give a number. But again, should you turn around and have an assessment done, we'll do our best to give you an estimate on likelihood of success. Which brings me to really the point that I'll say now and I'll say at the end. To have this assessed, what you need to do is either call the clinic or make an appointment through the website that is listed. Now, what will happen is it's a two-part system. Number one, depending on the number of joints will depend on the fee to be assessed. So it's $50 for the x-rays and assessment of 1 or 2 joints. It's $100 for 3 or more joints. And like I said, you can call the clinic and reserve a time. Our next treatment date is Friday, September 25th, which means you need to make an appointment at a minimum 5 days before that. If you're on any medication, we recommend you make an appointment at least a week before that so that you have the opportunity to do any medication modification leading into the treatment itself. And we do utilize nurse practitioners and often people on lots of medication. We may even reach out to your doctor to most effectively and safely do this. The downtime is very minimal, so very different from surgery. Think about just the cost to your life being laid up for 3 to 6 months with a joint replacement. For stem cell therapy, you walk in and out the same day. You can drive yourself. Now, for those people that are very competitive athletes or work out very intensely, you may have a 2, 3, 4 week, very intense athletes, possibly as long as 8 weeks gap with working out very, very hard or pounding on the joint. But ultimately, you're going to lead your normal life the same day, which is vastly different from a surgery. The results, so we've seen people see results in as little as 4 days, but the highest results typically are noticed at the 3 to 6 month mark. So yes, you can see it very quickly, but remember the cells are replicating, and so over longer periods of time, people tend to notice more and more results. Now, if you thought about like, well, how come my doctor hasn't recommended this? This is one of those things. It's very similar to, in my opinion, chiropractic after back surgery. Let's just say somebody has back surgery. They're in severe pain. They have no other choice. They have to have back surgery. Well, the reality is that somebody that has back surgery will need 3 to 5 surgeries in their life on average. And most people go into back surgery thinking it's just going to be one and it's going to fix them forever. Those that continue alternative treatments, chiropractic, physical therapy, mobility training, they statistically have dramatically less surgeries. Unfortunately, though, surgery is a much bigger moneymaker. A few $1,000s for a treatment that could save you from a $50,000 or $75,000 surgery doesn't make a whole lot of financial sense. I'm not saying that your doctor doesn't recommend it, but I am saying that to some degree, not that different from vitamins and supplements and lifestyle treatments, it's not what they're always educated on. They often would have to seek this education elsewhere because most education at this point in America is funded by the pharmaceutical companies themselves. Right or wrong, that's the way it works right now in this country. So again, to see if the treatment is right for you, we are trying to have a low cost or low barrier of entry for you to be assessed, which is why we're keeping it to $50 for the 1 or 2 joints or $100 for 3 or more. Now, like I said, this cost comparison, the downtime, the treatment, the therapy after, just the out of pocket that most people spend. While stem cell therapy is not currently covered by insurance, in most cases, it is lower than the out-of-pocket on what you'd spend on a surgery itself. So the investment is an investment, but it's something that for most people, it's still more cost-effective than having surgery. Not to mention, even if you take short-term disability and have that 40% less of your paycheck while you're laid up. So I get asked a lot about success stories. I mentioned, I always mention this. My grandmother was told she had MRIs on her knees and her shoulders. She was told that she had to have double knee replacements when she was 80 years old. She just turned 82 and did her stem cell therapy in last November, and she's doing fantastic. Her shoulders, they were so deteriorated that she was told she couldn't even have shoulder replacements. She couldn't put her hands behind her head to do her hair, to comb her hair, to wash her hair. And she lives alone. She lives in her own house. She's a very functional person. And so this has been a completely different quality of life for her. A gentleman named Jim that we just did about 6 weeks ago, I asked him the other day how his hip felt. He loves to play golf. He's retired, and he had his left hip injected, and he said, my hip feels so good that now I realized that my right hip had some pain in it, and my left hip was so painful and so limiting that I didn't even realize that some of my other joints had been breaking down. But now he's able to do more. He's able to play golf. He's able to function. And, I could go on and on about all the different people. Like I said, is this 100% guarantee? Absolutely not. As much as I'd like it to be, there are limitations of matter. There are limitations in people. People do respond differently. But like I said, for a ton of people, it's radically different and radically better. And so if you are interested in this, go ahead, schedule an appointment. We have availability Monday, Tuesday, and Wednesday in this upcoming week, and then Monday and Tuesday the following week for the first date. So there are only 5 days of availability. We will have a follow-up roughly a week later, but we don't have the date set, and it will depend on demand. Lastly, we're hoping to soon start to be able to do live classes and live seminars where you can meet the practitioner, but unfortunately, due to current circumstances, we're still on Facebook and YouTube only. So if you have any questions, feel free to private message us directly, or like I said, call the office and set up an appointment to do so. Have a very, very blessed day.